tech is not the blocker. You don't have to prove to me that you can build the tech. You have to prove that someone's going to pay for it.
Nick Culbertson, thank you for joining me on the podcast.
Great to be here, Logan.
So you are the managing director of a new accelerator in Baltimore, a Techstars accelerator focused on AI in health. And you came to the world of accelerators after being the co-founder of a health tech company yourself, ProTennis. And so I'm curious, just to get us started, just give us a little bit of the story of the journey of how the founder of a company like this ends up being the director of an accelerator.
Well, it's a nice full circle story because I started my company out of an accelerator, and
Okay.
accelerators exist for people like myself that had no idea about the entrepreneurial world, how to build a company from scratch, how to get something out of nothing. And they take people working on interesting projects or interesting ideas. They're either made a little bit of traction or have made zero traction, and get them ready for investors, get them ready with their product market fit, get them ready to start commercializing. And the ideas that you come out of an accelerator with a little bit of boot camp skills on building a business, and enough information to be deadly in the entrepreneurial journey. So
Which
that's what I
accelerator
did.
did you go to?
So it doesn't exist anymore as an accelerator. It's a company called Dream It Health.
Hmm.
So it was a healthcare accelerator out of Dream It, like Dream IT.
Dream
Um,
Adventures in
Dream It
Philly.
Ventures, yes, and I think they now do venture capital. I don't think
Uh-huh. Okay.
they do the
Yeah.
full accelerator thing. And I went through that program in 2014 with my co-founder Robert Lord, and we both started Tennis.
And you said it was perfect for people like me. What was a person like you at that time?
So I think I kind of got tricked into going through an accelerator because Robert and I were working on a research project together, and we Hopkins was going through a little bit of an entrepreneurial midlife crisis where they wanted to encourage more commercialization out of the research coming out of Hopkins. Hopkins,
Okay.
like number one, has been for a long time in NIH dollars and research grants, but it's not like Harvard or Stanford or MIT, other universities that have commercialized a lot of big tech companies.
Sure.
And so they brought in DreamIt and some other programs, and they really built up their innovation infrastructure now. But at the time, we were two med students that were working on this project that seemed to have some market potential, and Hopkins administrators really encouraged us to go through this accelerator. I did research, and I was kind of pitched to me as a a mini real world business school experience without a degree, and I was
Hmm.
like, it sounds very interesting to me, and I'd like to learn more. And I thought I'd spend a semester off and come right back and finish med school.
Okay. So you'd been in med school. That was your primary background, not in
Yeah,
business.
that's right.
Okay.
So my co-founder and I we both came to Hopkins to be because we were interested in research. Hopkins is a really good research organization,
Yeah.
and we were doing our own projects on the side, and we just became friends, and decided to do a research project together that combined our backgrounds, and it all kind of built up from there.
Okay. So AI in health. That's the theme and name of this Techstars in Baltimore. Tell me about your first cohort, your first demo day. How did it go?
Well, let me back up and just say our investment thesis at Techstars AI Health Baltimore is that we believe and innovation has the opportunity to really impact healthcare economics, not only improving access to care and improving patient outcomes, but the US spends almost double of what other developed countries spend on our healthcare and doesn't necessarily have better results in every area. And so we have a real opportunity to leverage AI to cut costs and make it more affordable, make a better access. And so the companies that I look for are not just really exciting companies. I think healthcare is a really fun space to innovate in, and it's an
Hmm.
area that needs a lot of innovation. It needs a lot of new tech to make our lives better. But I look for companies that have a clear ROI somewhere in healthcare, and it's a pretty broad mandate. We could bring in health tech, biotech, med device. There's so many different opportunities. So, for example, in our first cohort, we had a biotech company that was using AI to optimize different modalities of selecting embryos to increase the viability for IVF. So right now, embryos have I think it's a 30% chance of a viability on placement, which means that most women have to go through multiple cycles of IVF, which is really expensive, which means most people can't afford IVF. And so what they've used is a really clever technique to bring in data from a couple modalities. They use some various types of spectroscopy and Fourier transformation of infrared to get data to then optimize to in a very cost-effective way to select the embryos and increase that rate. And they've gotten tests recently up to above 70%.
Yeah.
So that's drastically decreasing the cost that would impact IVF, thereby impacting care. Complete opposite end of the spectrum, we had another company that uses AI to look at contracts in hospital system to find missed rebates. So their value proposition to hospitals is we will literally find you lost money in our first year of working with you,
Mm.
because hospitals deal with very complicated contracts that little different types of rebates that could slip through the cracks and are very hard to maintain. So another
I,
really great example of
I
AI.
know it's a different business, a completely different business, but did that resonate with you because of your work with ProTennis in terms of the idea of sort of leaving money on the table? I know you dealt with risk and with fraud. Is that right?
It did, in fact. So I joined Techstars right before our program started, and I met the founder of this company, and I recruited him into the Baltimore program because I saw immediately this is the unsexy underbelly of healthcare that's
Yeah.
often missed. A lot of people focus on the front-facing clinical opportunities because it's what we know. But on the back end of healthcare, there's a lot of regulatory and administrative burden for health systems where there's a big opportunity to impact economics today.
Would you say you and your team, and maybe in this accelerator at large, would you say you are focusing more on that unsexy back end, the like strong economics versus the shiny front end than maybe another accelerator would? Like, is this a distinguishing factor for your accelerator?
So we are the flagship healthcare accelerator for Techstars, which means we have a lot of flexibility.
Okay.
We don't have so we have Techstars has a couple partner programs with health systems that are looking for companies specifically to work with those health systems. We have a lot of freedom that we can select companies that are consumer facing, payer facing, provider facing, like I mentioned, device
Yeah.
software. It could be anything. The key though is we don't just look for companies that we think are going to do well. We look for companies that we think are going to do well and we can help the most.
Okay.
And Baltimore is uniquely situated in that it has really great access to strong health systems, strong academic institutions, really great partnerships between payers and providers, and then access to venture capital along the Eastern Seaboard, and then the regulatory headquarters with all of the access to DC in our backyard. So it's just a great pool, which is, I think, one of the many reasons that my company was able to get off the ground and achieve the success that it did is because of this environment.
What are the biggest misconceptions about Baltimore that you have to face when you deal with investors or potential partners from other parts of the country?
Well, the same misconceptions that I had when I came to Baltimore. Everyone comes to Baltimore and they hear about the wire and they hear about crime rates, and then you come here and it's called Charm City for a reason. And I think there are many pockets of Baltimore that are lovely, great to live in. It's very affordable. It's a great community. Everyone supports each other. But it's that I didn't realize even living here some time how easy it is to build to leverage the Baltimore network. So,
Mm.
for example, the fact that a med student could talk to key executives at every hospital system in the state to get feedback on how this product would be successful. Like most startups, especially in highly regulated industries, aren't like light bulb ideas that you think of on a run or in the shower.
Mm.
They're they're iron tested by the feedback of subject matter experts who really know the space and know these like idiosyncratic nuances that someone off the street would just not know. And so that access to individuals is really what makes Baltimore a powerful incubator bed for startups.
Okay, so you just finished the first cohort. You had your demo day. Real quick, demo day success. What was it like to do your first demo day?
Yeah, it was very odd coming like a 10-year journey from when my co-founder and I did our first demo day to now having our first accelerator here. But it was great. 10 companies did really phenomenal with their pitches. It's really fun to work with entrepreneurs behind the scenes to get their messages down to a discrete amount of time. We had some wonderful keynotes from Care First, Blue Cross Blue Shield, and Johns Hopkins, and Techstars as well, talking about why we're investing into the Baltimore ecosystem. Um, and the company's knocked it out of the park. It was a great event, and we had some really exciting traction come out of it. Every company was able to talk about the commercial traction they achieved in program,
Mm,
which is music to investors' ears because they want to
okay.
hear how your product is being effective, how you found product market fit.
And specifically, we haven't really talked yet about Hopkins and Care First being the backers of this or being the key partners of this program. So, what does it actually mean logistically for one of your cohort companies to benefit from that relationship?
Yeah, so we do have two sponsors, Care First and the Johns Hopkins University. Johns Hopkins University gives us access to both the health system, but also the academic institutions, which is building a lot of investment in AI. Their initiative around the data science and AI institute they're building at Hopkins is really impressive. And so the access that they give us is basically just that. It's that they help us select the companies. They do. Clinical and scientific validation on the founders and the tech. And then what they do is they provide access to their networks of subject matter experts. So there's no guarantee any company will get a deal with
Yeah.
any of the organizations, but it is open access to the right key personnel. In fact, I think between our partners, we had over 50 warm introductions for the companies to make them more successful on their journey. But it doesn't stop there too. We have a lot of other health systems and all other payers that we work with and partner with in a more informal capacity to get startups the feedback they need.
Obviously, there's like this top level of what you're looking for in the cohort. It's got to be a game-changing company. It's got to have this strong ROI. Traction's great. All these sorts of statements that are helpful. Let's get a little bit more granular as to what you're really looking for, and what's really going to stand out as you're looking through these pitch decks.
Yeah, so I'll preface this with all of my experience I've learned from really smart, wonderful advisors that have helped coach and mentor me along the way. So I just want to caveat everything that this is not all Nick's work. This is a amalgamation of like so much incredible feedback that I've received. But we look for four categories for companies. We evaluate it's the four T's. We look at their team, who the founders are, do they have the right founder market fit, do they have the right expertise, is there a healthy composition of the overall team? We look for the tech. We understand like, is there anything that's unique? How does it compare to the competition? We look for novelty. Like, is it patentable? We look at to see what the margins are, how will it scale, what the cost is, what the value proposition is interpreted by customers. We look at the TAM, we look at the total size of the market to understand how big of an opportunity is this really. And then most importantly, we look at the traction. And I think this is the area that early stage companies struggle the most
Yeah,
because they think that you need to raise money to hire the team to build the product to get the customers.
yeah.
And the reality is the first thing you need to do is talk to customers. So I ask
Talk to them, yes,
questions.
but how do you gain traction? It's like the old you have to get an acting job to get a SAG card. You can't get an acting job without a SAG card, right?
Yeah. So one of the questions I ask is, how many customers have you talked to?
Okay.
And they start talking to me. I'd say, okay, well, what did they say about the product? And
Yeah.
then, like, what was the feedback? Is it a problem? Is it actually something they were interested in? Does they even recognize that do they agree that this is an issue for them?
So in this framework, traction could be customer feedback.
Could be customer feedback, but it's always about upping the ante. So if they're like, yeah, I talked to 10 customers, then I immediately say, great, how much did you say this product will charge? And if the answer is like, well, we didn't talk about that, and I say, you got to go back to go. You got to go back to the beginning because if you're talking to a customer without the context of willingness to pay, the feedback you have is not as helpful. Because if I say, do you love this, little widget I built? You might be like, yeah, that's great. It's so awesome. And I say, well, would you pay $50 for it? And you're like, no. I'm not paying $50 for it. It's great. It's nice.
Yeah.
I'll use it if you want me to, but I'm not paying for it. So you really need the feedback in the context of the economics.
Well, let's dig into that a little bit more because when I think traction, I think, oh, I have to have a product that I actually sold to somebody and they're using it. And you're giving an example of how you can start with traction very, very early. So, what other ways can you demonstrate traction when you still need to raise money to build a widget?
Well, again, it's always about upping the ante. It starts with expressing interest, then it goes into talking about the economics and like what the willingness to pay is and
Hmm.
measuring that and building an understanding of the market around the context of that willingness to pay. I look to see is that price point that you're talking with customers add up to your TAM, or is there a big gap in those numbers? If there's a million salons and you charge $1 a year, your market is $1 million. That's as big as it's going to get. And there should be some kind of intersection of that math. Then it's about talking about, okay, if there's really willingness to pay, then what does it take? Think about where you are today and the date that they give you that money, and what's the shortest line between those two dots. And yes, that may require building a product, that may require fundraising, but it's really having an honest conversation with your customers about that process. And so I'll give you an example. What my co-founder and I did was we talked to Hopkins about our product, which we used AI to catch different types of fraud in hospitals. And we zeroed in on like, what is this worth to you? What is the actual problem? How can we specify what the problem is? What would you expect success criteria to be? And then what would you pay for this? And we wrote up a contract with, I give Hopkins a lot of credit for being innovative 10 years ago, coming up with this concept. But the contract said, we will pay you no money. If you build this thing that does X, Y, and Z, we'll pay you money. And I could go to investors and say, Hopkins is willing to pay six figures for this problem that I've identified. I just need to hire a team and build it.
Interesting.
So
Okay.
I could tell investors that I have willingness to pay because Hopkins has expressed willingness to pay, but Hopkins has no risk because if we don't build it, that we wasted a bunch of time on developing this contract. But if we build it, they get exactly what they want and they're willing to pay for it.
Okay. Kind of what I hear you saying, not everyone's going to be able to do that kind of arrangement, but what I hear you saying is get creative, think outside the box on how you prove that traction.
Yeah, and that is just an example. The 8 companies that went through our first program used all sorts of creativity
Yeah.
to partner with organizations to get some early traction. And sometimes it's a letter of intent, a letter of interest.
Yeah.
Sometimes it's the customer interviews and discovery. Sometimes it's putting together some type of contract. Sometimes it's doing a pilot or a proof of concept. But there's a lot of different ways, and especially in the world of generative AI that we live in now, tech is not the blocker. You don't have to prove to me that you can build the tech. Like when I said we used AI to catch fraud hospitals, your head did not explode at the possibility of that. You're like, yeah, that makes
Yeah.
sense.
Yeah.
You have to prove that someone's going to pay for it. And so you
Yeah.
have to prove that first before you build the product.
I know it's called AI in health, and I know it's about using AI for healthcare products. Have you seen this cohort utilize AI just in building their slide decks and building their communication strategy? Like, how did you encourage them to use that technology in the actual program, if at all?
So creatively, I felt like I didn't need to encourage them. I think founders are figuring this out for themselves, that
Mm,
there's all sorts of really fun ways. We provided a designer to help build pitch decks to make them really fancy. And then we saw our founders iterating on the decks on their own and coming up with really great artwork consistent with what the designer made because
that's
they were like, oh, I just need to tweak this here, put it into a tool and spit it out, and it looks great.
mm,
And so I think that was it was really fun to see, but there was a lot of creativity to it too. One of our companies uses AI to generate compliant medical content,
mm.
which is a very expensive process right now for advertising agencies to generate content that has to follow the science, follow the regulations, has to say the correct things, and to tweak it a little bit, you have to go through a whole process that could cost, 50 grand in a couple months, and their AI can do it in a matter of minutes.
Yeah.
And it's really cool. And what they did is for demo day, they came up with some medically accurate, scientifically consistent poetry to
Mm.
show how easy it was to generate, this content using this technology. But it was a really cool marketing tool. that they use to talk to their customers, and it demonstrates how like being creative, you can use these tools to help generate that early traction.
You know, AI tools like Gemini or ChatGPT can be so great for strategy sessions and like, hey, help me brainstorm this. Did you ever run into a situation, or have you, where that went a little too far and you're like, you know what, actually you're outsourcing a bit more, too much of the thinking. Let's reel it back in.
That's a really good question. And I think nothing's black and white in entrepreneurship. It's always about the right amount of touch. And one of the things we talked about most is while early companies should be iterating over their products, how do you actually build the long-term solution? So one of our companies used some AI tools to get the product off the ground, to demonstrate it, to get something that's functioning, started to generate revenue. But then the question became, okay, is this person was not a software developer, had used did vibe coding to get to where they were, and it was really effective to get that early traction. But then it's a question of like, okay, should we now hire a team or outsource to contractors or build a more enterprise ready scalable solution now that we've gotten this traction and we have, the resources to do it. And even then I think you can still use AI to make that process really efficient. But it was a really thoughtful process to get that balance of speed to market and feedback on the product and identify the ROI. And then what's the right way to do this?
Yeah.
And that's where we wanted to bring in software engineers and developers who had a lot of expertise to make sure that the entire infrastructure was thought through.
Yeah. Well, so what I'm hearing you say, there could be a temptation to sort of take that vibe coding or concept and like take it all the way to a final product, and sort of not bring in the teams necessary to kind of just do it right.
Yeah, and I do think it's my favorite word. It's a nuanced topic because AI is changing on a daily basis, the speed that it's improving.
Yeah.
I don't want to say there's some absolutism where you can't build an enterprise ready solution
Yeah.
through vibe coding. Like that might be true a month ago, and next month it might not be true.
Sure.
So I think it's really just about asking what's the right tool for the right job.
Yeah. What are the ethical implications that you hope the next cohort are really thinking about in terms of the use of AI?
So I am a big believer that AI needs to be used in healthcare for good. And one of the themes I'm seeing as we really go through our cohort is not just the economics, but the access. And I think you can't tell me an AI is going to replace a doctor when today doctors don't have time to treat every patient, or every patient can't afford to see a doctor. And so that's really what I look for too, is seeing how are we helping the most disenfranchised, the difficult patient to reach. So that goes out to rural medicine, big population health, individuals of without insurance. What are the ways that we can actually increase coverage or increase care for our most vulnerable populations?
Final question. You're at the heart of this AI movement in health. All these companies surrounding you. It's like future, future, future. I keep bumping up against folks talking about sort of an analog renaissance in terms of like their desire to connect person to person, and not let AI sort of rule their lives or push them too far. And I just want to know if you could kind of comment on the duality of that, of being at the center of this tech revolution while also needing to connect human to human and kind of understand its limits.
Yeah, it's a really good point, and I think it really is important to have both. I think AI is not here to take away our humanity, and just an example of that is I think surprises some people sometimes is that we're a strict in-person program. And a lot of accelerators say, oh, you can do this remotely. And I'm like, you can't. You need to be here in Baltimore. You need to meet the people that we're going to introduce you to face to face. You need to go
Mm,
visit their office, meet them in a coffee shop. We do our classroom together. And I don't use a TV, and I don't use a PowerPoint, and I don't record the meetings.
yeah.
We're just going to talk, and we're going to talk about experiences. We're going to talk about challenges, and we're going to get that kind of raw conversation that is not um, easily condensed down into a PowerPoint.
Yeah. No one has their AI note taker in the meeting. No one's getting a summary at the end.
A lot we do. So we do optimize the tools to make it really easy, and I stress the strictness, but we do have a little bit of flexibility. Sometimes people are traveling to meet customers or
Sure.
conferences or whatnot, and so we'll create an opportunity for them to dial in. But I think compared to most programs that have a lot of flexibility, we do really try to focus on the human component, the relationships, and I'm trying not to see the friendships along the way, but you know what I mean.
Yeah, love it. Well, Nick, thank you for taking the time with me. Love that you're doing this in Baltimore, a city that I love. Excited that you're heading into a second cohort. My guess is you're just going to keep building on the learnings of each previous cohort, so it'll get better with time. And so I wish you all the best as you go forward.
Thank you, Logan. I really appreciate it.
All right, take care. Be well.